Assalamu alaikum. I am Dr. Ehtesham Shoaib going to present drugs for cough. This video will discuss about the drug for cough. Actually, there are two types of cough. Number one, dry cough, and another is productive cough. Dry cough means there is no sputum production, usually found in upper respiratory tract infection. Usually, following upper respiratory tract infection, we found dry cough. Another type of cough is productive cough. It's mean cough with sputum production, usually found in lower respiratory tract infection, for example in pneumonia, bronchiectasis, and etc. At first, we will discuss about drugs for dry cough. It is usually called as antitussive. Antitussive, also known as cough suppressant. It is the best choice for dry cough. It includes opioids, NMDA receptor antagonists, that is dextromethorphan, local anesthetics, antihistamine, and butyrate citrate. Actually, those are the cough suppressant useful for treatment of dry cough. Actually, they suppress the cough either by acting on central nervous system or by inhibiting cough reflexes in the respiratory tract system. Actually, they suppress the cough either in central nervous system or cough impulse in respiratory tract. They block the central nervous system or they inhibit the local cough impulse. Actually, they suppress the cough either by acting on central nervous system or by inhibiting cough impulses in local respiratory tract. For this reason, they also called as suppressant, cough suppressant. The mostly used and most common drug, that is butyrate citrate, belongs to a cough suppressant. It actually acts centrally through the receptor in the brainstem. It has two additional effects, that is inhibiting bronchospasm and inhibiting anti-inflammatory effect. So, butyrate citrate, that is locally found as Bucough, has three main effects. Number one, on central nervous system through the receptor in the brainstem. Number two, inhibiting bronchospasm, and number three, anti-inflammatory effect. It is rapidly absorbed after oral administration and its therapeutic concentration determined after 5 to 10 minutes of administration, irrespective of the doses. Another drug for dry cough is dextromethorphan. It is an NMD receptor antagonist used to treat dry cough. Dextromethorphan often used in combination with brompheniramine and pseudoephedrine, used to treat cough and upper respiratory tract, and associated with allergies because it has antihistamine. Almost all the cough syrup has a component that is dextromethorphan. It's very much common, and we found it with combination, either antihistamine combination or pseudoephedrine combination. Next is antihistamine, that is diphenhydramine and triprolidine. Diphenhydramine is very much useful if the cough is caused by postnasal drip, and triprolidine has an additional anticholinergic properties. As it is an antihistamine, so the side effect is drowsiness. The common side effect is drowsiness. The most powerful and the oldest cough suppressant, that is antitussive, are opioid, that is codeine, fulcodeine. But it has several adverse effects, that is abuse, sedation, constipation, and respiratory depression. For this reason, It's the drawback of codeine. We don't use codeine. We use another drug, that is dextromethorphan or butyrate citrate. A question frequently comes to our mind and frequent examinations, that can we use codeine and dextromethorphan together for additional benefit, for exaggerated synergistic effect? The answer is it is irrational. Irrational. There is no such type of indications to use both opioid and dextromethorphan together, because it will produce more side effect, more adverse effect. So combination of dextromethorphan and codeine is totally irrational. Our next type of cough is productive cough. Productive cough means sputum production in lungs. What is sputum? Sputum is nothing but the mucus. When the mucus is very thick, when the mucus is not coming out easily, then we will have to use mucolytics. What the mucolytic does? Actually, it converts the thick sputum into thin and watery sputum. Thin and watery sputum, so that it can easily come out. What are the mucolytics available? That is A, B, and C. A mean ambroxol, B mean bromhexine, and C mean cysteine. It has two types of cysteine, that is carbocysteine and acetylcysteine. At first we will talk about bromhexine, that is commonly found as mucolytic. It is indicated in the treatment of respiratory tract disorder associated with productive cough. It is an oral mucolytic agent. Mechanism of action is disrupt the structure of acid mucopolysaccharide fibers. The thick mucopolysaccharide is disrupted by the mucolytic agent and converts or produce less viscous mucus, which makes it easier to expectoration. It is rapidly and completely absorbed from the gastrointestinal tract. Another group of drug is ambroxol. Ambroxol is the active metabolite of bromhexine. It has proven that it metabolizes possesses greater bronchosecretory effect than bromhexine. So it is proven that ambroxol is more effective than the bromhexine. It facilitates expectoration of mucus and reducing dyspnea. It has an additional anti-inflammatory effect, and traditionally it is used in COPD. It improves airway patency in case of COPD. Another and last cysteine, that is mucolytic drug, is acetylcysteine. It is also a mucolytic agent and reduces the viscosity of secretions. Another use of acetylcysteine in case of antidose paracetamol of paracetamol poisoning. Next group of drug in case of productive cough, that is expectorants. So in case of productive cough, we use the mnemonics, that is ME. M for mucolytic and E for expectorants. What that the expectorant means? There is another more common concept, that expectoration of cough. Expectoration of cough means increase the throughout of cough. Increase the throughout of cough. Mucolytis makes the cough thin and watery, and expectorants increase the throughout of cough. And guaifenesin is the drug that has the expectorant properties. Guaifenesin is reported to reduce the viscosity of sputum and used as an expectorant. So here all the drugs in together. Basically, it has two types of drug. That is, for dry cough, we use antitussive. It includes opioid, that is codeine, fulcodeine, non-opioid opioid, that is dextromethorphan, antihistamine, and another drug. We also used for expectorants. Expectorants mean me. M for mucolytic. Mucolytic means A, B, C, and E for expectorant, that is guaifenesin. We have some additional adjuvant antitussive, that is bronchodilator effect, that is salbutamol. Sometimes we use this in case of children. It has bronchodilatic effects. This has Puricell, Brodil. We can use in local name. Sometimes some lozenge, syrup, juice, glycerin has some local pharyngeal effect. This also has some effect for drugs. And sometimes we use some local anesthetics. So a question commonly comes to our mind: what will be happened if we use cough suppressant in case of productive cough? If a patient has productive cough and we use antitussive or cough suppressant, what will be happened? A patient has productive cough, that means the infection in lower respiratory tract. For this reason, we will have to do two works. Number one, we will have to convert the thick sputum into the thin or watery sputum, that is mucolysis. Then we will have to throw out the sputum, that is expectorants, guaifenesin. This is the mechanism of drugs in case of productive cough. But if we use antitussive, that is cough suppressant, in case of productive cough, then cough will not come out easily. Then cough will store in lower respiratory tract and causes pneumonia. Cough will not come out easily and cough will stored in lower respiratory tract. For this reason, we never use antitussive or cough suppressant in productive cough. Antitussive will be used only in dry cough. Thank you all.